Dr. Charles Sue, an orthopedic sports medicine surgeon at UVA Health. He's sitting down with Casey.
All right, thank you so much, Steve. Thank you so much for being here with us today.
Absolutely. Yeah, happy to be here.
Yeah, we're happy to have you. And we're talking about some of the most common injuries that you see in active athletes. What would you say some of those are?
Yeah, so I think sports injuries, we can broadly split them into two broad categories. Some of our acute and chronic injuries. Acute injuries refer to those that occur kind of more suddenly. So when you have a fall while running, trip while kind of playing basketball, or kind of a tackle during football. Some of those acute injuries include things like ACL and meniscus tears, fractures or breaks in the bone, or shoulder dislocations. Chronic injuries refer to more overuse type of injuries. They tend to develop more gradually over time. And some examples of those include things like arthritis, tendinitis, and stress fractures. In terms of body parts that are affected, the four most common body parts are the knee, shoulder, ankle, and hip, with knee injuries comprising over 50% of the most common sports injuries.
Yeah, unfortunately something you kind of expect to see in sports injuries. What would you say are some of the steps that athletes can take to help reduce their risks for these types of injuries in the first place?
Yeah, it's a great question. And unfortunately, for some of these kind of acute traumatic injuries, they're unfortunately unavoidable. But injury prevention remains an important goal for not only athletes but medical providers as well. And there are certain steps that can certainly be undertaken to minimize our risk. So first and foremost, with any sort of sports participation, exercising with proper technique is really important. Secondly, using proper footwear and equipment is also an important contributor to minimizing our risk for injury. Overuse and overtraining, leading to some of these more chronic overuse injuries, is also something that we see very commonly. And so making sure we have adequate rest between practice and games can be very beneficial. Particularly for our younger athletes, there's pretty good data now to suggest that diversifying the types and number of sports that we engage with early on and not doing the same sport for the whole year can help minimize some of our kind of chronic injuries in these younger athletes. And finally, I think injury prevention also changes with age. And so as we get older, our bodies and our joints may not respond as well to sudden increases in activity level. And so easing into new sport, or maybe even transitioning to lower impact activities, can also be helpful in minimizing injury.
Awesome. So a lot of things you can do that really can make a big difference. When should athletes who are dealing with one of these types of injuries actually come and see a doctor?
Yeah, so it depends a little bit on the type of injury. For any of these big acute traumatic injuries where you have a lot of swelling to the joint or bruising, any sort of new weakness, or significant pain with even a basic activity like walking, you should probably see a medical provider sooner rather than later. For some of these more chronic injuries, it varies a little bit and depends on how badly it's affecting your quality of life, your ability to engage with the activity that you want to participate in. And here in Charlottesville, we're really fortunate to be able to have the UVA Orthopedic Center here on Ivy Road. It's actually one of the largest orthopedic centers in the whole, orthopedic outpatient centers in the whole country, and provides not only access to orthopedic surgeons, but physical therapists, imaging and MRI capabilities, ultrasound injections, as well as the ability to fit our patients with custom prosthetics and orthotics as well.
Amazing. We always say how fortunate we are to have that right here. Not many people can say that. Mm-hmm. Well, thank you so much for taking the time to be here, and I'm sure we'll have you back soon.
Absolutely. Thank you for having me.
Yep. Steve, back to you.
All right, time.